Oh, right. All right. Can you guys see me now? I guess it's just going to be one of those days. All right. Sorry, guys. I'm having some internet issues. I don't know what the heck it is. It just, I guess it's those days, one of those nights. It's just as I was in the middle of a story. But my point was this, guys. We have been trying for 2 years, trying to get out the information, trying to provide you all with the science based, medical based facts. And, we have sought after some amazing guests. And I don't know where, or I hope our guests come on. But anyway, yeah, I don't know what happened. It was just, I was having some issues with the internet. It just stopped right in the middle. Sorry, Mireille. Sorry for our Clubhouse viewers, guys. We're on Clubhouse simultaneously. If you haven't checked it out, watch in the comments. You'll see a link for Clubhouse. It's an audio uh, Clubhouse where we get together and we share ideas. We will be getting on Clubhouse right after tonight's show. So someone will be posting the link. It's a free. You download the app and they'll help you get started. But it's an amazing tool that we use. We can communicate with doctors across the world for free, experts, which actually brings me to my point where we have been trying hard to provide you all with the information so you all can make decisions, whether you agree or disagree. We're not here to convince anybody. We're not here to force anybody, but we are trying to provide information that we believe is factual and science based. So that's what we aim to do, and we hope that we're getting it across. I was talking about was I was getting very, I felt defeated, deflated, and just reassessing is what we're doing helping? Are we even making a difference? And I received a few messages today um, from people. Okay, what's going on? Hang on, man. I had to change. I had to swap out computers. So bear with me, guys. Bear with me. Okay, hold on. Bear with me, please. The link is not working. Sorry, the link, because I changed computers, I think it puts up a whole new link. So I gotta send the link over to Charlie and to Dr. Miscovich. Again, sorry about this technical difficulty. So now I gotta send this link. That's why I love live stuff. Anyway, so I got a couple of messages today from a couple of the villagers sharing their appreciation for the information that we provide, and it really made me think about what is our motive, and our motive is really to inform and educate. And when our system is working right, it's a great thing. So, but when it's not working, like right now, it's a little frustrating, and it adds to my It adds to my frustration. So bear with me. We are live, guys, and I know I invited the media on tonight. They're probably watching and say, "Look at this! Look at this guy. He didn't know what the hell he's doing. Can't even get his thing to work." Yeah, well, I would feel the same way. Okay, there it is. Okay, now I copy this link on my phone and I send it to Charlie and I send it to. Am I frozen again? Are you guys kidding me? Okay, all right. We got a lot of you on tonight. Charlie, I have you on, but I don't have the. There we go.
Okay, all right.
There we go.
A lot of you on tonight.
Carlos,
Charlie, I have you on, but
are you muted or are you just trying to drive me crazy?
no, I'm here. Aloha no,
Okay, great. I
aloha
cannot
no.
hear you now.
No, no, I'm here. I'm here.
Mm-hmm.
I am live. Aloha no, everyone. Good to see you all.
Sorry, Charlie. We've been having some issues like you would not believe.
Hey,
But I never said I was a tech expert.
let me take off my jacket. I just got in.
Never said I was a. Hold on here. Let me go fix my audio.
Aloha no. Yes, there we are.
Can you hear me now, Charlie?
I hear you loud and clear. Loud and clear.
I cannot hear you at all. Gosh. Can you guys hear me?
Yes,
Okay.
yes, yes, yes. Yep, you sound good to us there, Mel.
What about now, Charlie?
I hear you loud and clear.
Okay. Bingo.
Yep.
Okay. So I had to change computers, Charlie. I don't know what happened. My other computer. So these nano, whatever, these AirPods not working. Anyway, we're in. I just sent the link over to Dr. Miscovich because I had to swap out my laptops.
Yeah.
So apparently, when I use a different laptop, it provides a different link. But
Oh,
anyway, so I can hear you. I can hear Charlie. I can hear. So we can. Anyway, Charlie, how you doing, buddy?
it's been a long day, and tonight is about the people of Hawaii. It's about our village. It's about what we can do. It's about things that's beyond our control. We can laugh about a lot of the crazy things that our government feels that is the right thing, and yet our village we have a lot of people with common sense. And the old saying is, man, you so smart, but you just lack common sense. We got people that are smart and have common sense. Sometimes it's frustrating how we walk the gauntlet day to day, especially now with this Omicron variant, as it's so-called referred to. But for the most part, staying healthy. Uh, I really cannot get frustrated, even though sometimes you want to get frustrated. I really cannot get frustrated with the amount of people coming in. Some of them they saved their whole life savings to come to Hawaii. Why blame them, right? I see them coming in fully masked. I see them get screened. They come in. Like anybody else that's coming from the mainland, they go through the screening process, they upload and this and that. But yet it is sad to see some of the new guidelines or recommendations from the CDC, and it's just sad. It's just sad. But for the most part, brother, I also like to say mahalo to everyone that complimented on my Manuheli design. It is another design. Yes, uh, Mrs. Stephanie Iona. Uh, she. And I also like to. Yes, Marlies, we still have. I have to drop off your candies. Yes, your daughter dropped it off. Thank you so much. I was caught off guard. Um, I had my Sunday's bet. Local boy. When you get your Sunday's best on, you just walk around the house in your bibbities. When he came knocking at the door, it's a good thing Mrs. Yona answered. But thank you so much. They came in the driveway. Our neighbor's dog was barking. All bark, no bite. But thank you, thank you, thank you. So that's been
Well,
it, yeah, brother. That's been it.
it's just been a rough day. It's I was talking about before you came on, before our stream got interrupted. I'm not sure why, but um, you know how I feel deflated. I feel defeated. I feel like all that we've been trying to do just falls on deaf ears as it relates to policymakers, decision makers. And I know I love your shirt.
Yeah,
And I wear
thanks.
my shirt special to those clowns
Oh,
that are making decisions at the state level, the city and county of Honolulu. It is don't be okole puka. And if you don't know what that means, it means, and I put out a warning. It may get graphic because I don't know if I'm gonna be able to maintain my composure tonight once we get into the discussion.
hmm.
Uh, because watching things unfold today from the HTA CEO, Mr. DeFries, trying to convince us that HTA is doing a good thing for our health and safety, to listening to Mayor Blangiardi point his finger and scold everybody that it's our responsibility and not his, to Governor Ige, and someone that I've lost all respect for today was Libby Char. And I know all the doctors say, Mel, she's a good person. We all are good people. But at some point in your life, you got to stand up. You got to stand up and you got to do what is right. And what I saw her do today was hide behind, avoid the questions. Listen, that's why don't be an asshole. we the country is blowing up, and I don't want to hear this nonsense about but it's just minor illness. It's the numbers, people. It's the numbers. It's the amount of cases that will generate more hospitalizations and more death. Yeah, not everybody's going to get seriously ill and not everybody's going to die, but the more it's a numbers game, right? And listening to these clowns today, listening to these okole pukas today, especially Blangiardi, who basically put it on all the people and said, don't look it's not our job. It's you guys' job. You guys go get the vaccine. You guys go get the booster. And if you're afraid, if you're afraid of it, stay home and lock yourself in the house. That's what he said. And Libby Char sat there, asked directly, what did you recommend to the mayors? Uh, 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 uh. We know she has the legal authority to implement restrictions under the HRS. She's not using her authority because of politics. I invited all the media on here tonight. I don't know if they're on. If you're on, please throw a comment in there so we know you give a damn. Because I'm tired of these political commercials that you guys run and make everybody look good when we are suffering. And if you guys haven't learned by now, and I'm talking to the media, and I'm talking to Blangiardi, and I'm talking to all our legislature, where are they? Illness follows cases in about 3 weeks. Deaths follow illness about 3 weeks. That's how this thing works. So you want to pretend like it's all minor? Pediatric hospitalizations across the country is rising 4 and 5 times. And our lieutenant governor get the balls to sit there and say, "Oh, we only have two." Only. Well, what if that was your kid, Josh Green? Would you feel differently? Yeah, but it's only two. Well, those states on the mainland had only two at one time, jackass. We have an opportunity right now to at least slow down the spread. But our leaders today, honestly, Charlie, threw us under the bus, slapped us in the face, insulted every single healthcare and first responder, healthcare worker and first responder. Slapped them all in the face. And to sit back and at the end of his little speech say, "Oh, I just want to really thank our healthcare workers. They're pleading, they're walking off, they're getting sick, some are leaving." So I hope the media is on, but they won't be. And even if they are, they're not gonna cover anything. Oh, Miscovich is on. I'm so sorry, Doc. I got carried away, bro. I am so
Oh,
sorry. How
oh
long were
no,
you waiting?
that's okay, man. Don't worry.
I'm prepping
I'm
the people. I'm softening them up before you because I know there's one more guy that's more angry than me in this room. And I just let me vent for a little while, and I
no, no.
will
You
get to
keep
that.
venting, please do, man. You keep doing.
Doc,
I'm enjoying it. I'm enjoying it. I'm
listen,
sitting
Doc.
back, loving every minute.
All you folks have done, Doc. All you folks have done from day one. And I'm talking about you and Altenberg and the Workin, O'Carroll, Brown, Jerome Kim,
Akiona.
Akiona, Murtaza, Chong Hansen. All of these experts have tried their best. The Workin even wrote a book, a roadmap to follow. And they have completely spit in all of your faces. They take a shit on me and Charlie, and I've had enough. I have had enough, and I'm gonna be honest. And I don't know if Charlie was on when I said this earlier. Today, I thought about hanging it up and just say, you know what, we're gonna take it. I'm gonna take care of my wife. I'm gonna take care of my kids, and we just ride this wave. And I got a couple of messages from a couple of the villagers sharing the value that they receive from our show, not from me and Charlie, but from the people we bring on. But watching what happened today, Doc, I realized that they do not give a rat's ass about the health and safety. In fact, Blangiardi had the gall to say, "Oh, I received a few calls from the restaurant people thanking me." I wonder how many calls he got from COVID victims. I lost two good friends in the last couple of weeks. I got a dad, a brother, and a sister-in-law right now with COVID. Charlie lost his brother. There's a lot of people. And for him to say, "I got a call from the restaurant people thanking me." Don't be an asshole, Blangiardi, Ige, Green. I'm over it, man. I'm over it. And I'm going to full screen you because I want to see me. I want people to see me get emotional, but I'm pissed. I'm pissed because they have ignored the science, they've ignored the experts, and they are on a path that's going to destroy a lot of our loved ones. And those of you that disagree or whatever, I respect you. Do not get silly on these comments because I will block your ass. That's all I got to say.
Well, okay. So all I can say, Mel, is as you know, as that conversation was going on, my phone and my texts were exploding. You and I were texting during it, and all those people you just mentioned, most of them, we were texting. And man, oh man, you do have to very much put an exclamation point about a guy I respect so much, and that's Tim Brown, because Tim was flowing expletives, back, and we've talked so many times since then, and we fact checked that bullshit conference that he put together that just basically spewed absolute false information to the people of our state and the people of Honolulu. Immediately as I'm going through this, I'm texting the people at UHERO and Sumner LaCroix, who's then sending an email off to Carl Bonham, and they're all like, "We never said that," and I'm cutting and pasting and sending the data, and they're like, "Never. This isn't anything. We never said that. That's nowhere to be found. The last thing we put out is December 12th." But yet he's saying, I could, if I was inside, I could put this up on a screen and I would hold it up here and I would shake it as he's ranting and raving, that I would show you that these experts are saying it's just mild like a flu. People die because of those comments. People die because of the reckless comments that have been coming out around the world saying, "No, it's Omicron. It's just like a flu. Don't worry about it." We do not have expert data on it at all. Yet, on the other hand, if you look at our own data, "Oh, don't worry, you're vaccinated." Well, then why are almost half of our hospital admissions now in the state of Hawaii vaccinated? If it's so mild and vaccinations protect you so much, why don't we state the facts? That the fact is that if you're vaccinated and you have Pfizer, 20% chance your Pfizer vaccination will stop you from getting Omicron. Again, your chances of dying are reduced. But what about long-term COVID? What about disability? What about being in the hospital? What about having, being on a ventilator, with all of these people? What about kids? Like we talked about, the 500% increase in hospitalizations for pediatrics, of which 50% are less than 5 years old in suburban New York City and all the New York suburbs. And what about 250% increase in Washington, D.C., which is surging? And what about the other fact that no one's talking about? We're talking about Omicron. Well, how about yesterday when the freaking CDC came out, which also should be hung out to dry on this because they failed us so much. And they basically said, on the 15th of December, we told you that 73% of the country, we were getting the genetic analysis was showing was Omicron. Oh, you know what? We made a mistake. It was 23%. So that meant as our country was surging and all these jerks were all saying, "Oh, it's Omicron, it's like a flu." 77% still deadly Delta. And then they revised it and said, "Oh yeah, well, Christmas Day, we did a revision and it's like 52%. Well, that's in the East Coast as it moves through. And so no one's talking about the fact that right now we are probably primarily still, majority of our cases are Delta, which is much more serious and much more deadly and still has an immune evasion. And then we haven't even started to have the full surge of Omicron right now. But yet, Blanche already talked to his experts, freaking Ray Vera and Jill Hogger Green. Excuse me, but those are people who run hospitals. Those aren't experts. They're very good in their right to running a hospital, but they are not people who are experts in data analysis and talking about what the risks are to the world. They're sitting there with their hands full running their hospitals. But excuse me, but please, when you talk about experts, there's medical experts and there's hospital administrative experts, which they are. So, if you guys would just see what my phone looks like and how it's been ringing and texting and going off the hook over since that absolute pathetically childish tyrant rage that went on. And then he criticizes the media. His own TV station, by the way, is what he was criticizing for telling the truth, and then criticizes Department of Health and their spokesman for saying we need to do something more and tries to bark them down. Pathetic. Where's the accountability? Where's the accountability for the people? You know who I'm calling on right now? City Council. Honolulu City Council, it's time to wake up, please. I have a lot of respect. I have good communication with Tommy. But Tommy, pull your people back in emergency session because you've let a true, true person that is on his own, just driving our island of Oahu down to crushing people's lives and where people will die because of the poor decisions. And many will die. And how ironic and how arrogant to look in that camera and talk about the healthcare officials. Oh, I really appreciate you people. If you appreciated them, you would prioritize them over the restaurant industry and the lives of the people of our state. So,
Doc, I know Charlie's ready to bark, but I just want to say I have sent out. You saw my post to all the legislature, both sides, councils and mayors to come united and urge the state to do the right thing. I sent that letter to the editors of the Garden Island and the Honolulu Star Advertiser. I don't know what else to do. We got to put pressure on the politicians, on the elected officials, and hold them accountable. They all jumped on the bandwagon for Red Hill, rightfully so. They should have. Where are they? Where are they to hold this rogue administration accountable? Nowhere. And a lot of these guys are my friends, probably not my friends after tonight, but tough crap. They need to stand up and hold these people accountable, bring them into the special session, and ask them the questions. Ask Blangiardi, who are his medical experts that advise him? It sure as hell wasn't the DOH, sure as hell wasn't any epidemiologist or infectious disease specialist. And something's gotta be done. And I hope that my letters to the editor will create. I know there's a lot of haters out there think that what Blangiardi did today was the right thing. And like I said, I respect that. But at the end of the day, I only care about keeping people safe. And one of the things I do want to talk about, I know Charlie is going to chime in, but one thing I want you to touch on, Doc, after is the schools. DOH came right after DOH. DOH said we're going to cut the quarantine time to 5 days, and you can get out of quarantine without a test. And right after that, in the middle of the Blangiardi fiasco, DOE follows and says face-to-face learning. So anyway, Charles going to try to mellow us out.
No,
good
no,
luck, buddy.
no, no. But I will say this much: I can't disagree with either one of you, but I'm usually not the type to blow my stack. Is because uh, in the past I have, and it pretty darn nearly got me thrown in jail. So I just have to, it's hard that when you get 320 pounds just going for it, it's hard to stop a wrecking ball when it wants to wreck. But I guess the point I'm making is this: everything you have said, clear as day. There is no rhyme or reason why they're saying the things that they're saying. Okay, so it's really up to us, really the smart ones, to really figure out that if what they're saying is hogwash, you go through life knowing that you don't listen to hogwash. You do what is right, and you follow what is right. Now, I think, Mel, for all of those out there that convince you not to hang it up, if this platform is needed to get the word out, you know, my dad always told me, son, if you're going in a ring with the attitude, you're gonna get knocked out. Then no go in the ring because you're gonna get knocked out. You go in there and you give them your best. You give them your best, all you can do. Because when the bell rings at the end and you walk out, you gave it the best shot you can. And I think, that's where I'm coming from, because there's still lives that depend on us. So now, getting back to the facts of the matter is, you've got all these people in high places that can really make a dent in this, but apparently they chose the low road. Okay, and that's why, when you're running down Scum Alley, that's what happens. You start spewing out a lot of this falseness and mistruths, or you take something that has partial truth, but yet the falseness outweighs it by 80%, while the partial truth is only 20%. So there's no credence to that, what is being said. So that's where I'm coming from. Now, talk about schools. Yes, I am somewhat bothered. As you know, I used to disinfect the schools for the DOH here on Kauai. Okay. I saw the time it took to disinfect the schools, and that's when Omicron wasn't here. And that is when Delta wasn't here. And as Delta came on board, then everything started to ramp up a little bit more how you would disinfect, right? And how you would do it. And you had to do it systematically because why? You have to cover front and back. You have to cover in places where you think, especially the rooms where you had your kindergartens, your first and second grades, because those kids will do things when the teacher's not looking, and they'll go into areas, and then you have the virus all over the place if there's an active case in that room. So those kind of things bothers me. Those kind of things do bother me. But I am so grateful that with Scott on board here, telling us what he knows. I mean, that's the closest thing you can hang on to is get an expert on this screen and just start laying it down because you got to agree, right, Doc, that you got people in high places that's just spewing all this garbage. It can mislead someone if the person who's watching tonight is really not strong in trying to get through this. My best recommendation is listen to Scott Miscovich. He'll guide you through this, because in fact, when I first met Dr. Miscovich online, not knowing that this is my brother's doctor on the windward side of Oahu, I tell you, he guided a lot of people. And so, for anyone out there that has weak nerves right now, now's not the time to bail. Now's the time to just listen to what this expert has to say. And that's, I think, where I'm coming from tonight. How's that?
Thank you, Charlie. You make my heart warm and fuzzy.
You bullshit.
You know, I'm going to turn you loose, Doc, real quick on the two things: the state's press release about the 5 day. I mean, if you test positive now, positive, not exposed, but positive, 5 days
Yeah.
after you test positive without symptoms, you just go back to work. No test, no. Dr. Char said, "Oh, because the test, you can test positive anyway if he was positive, and those home tests aren't very accurate." You got to be kidding, lady. Why are you telling us this now? After you made thousands of people go out and buy this and using this test to get into restaurants and to bars and to weddings, and now you're telling us, oh, it's not that accurate? You guys get your anyway. So that's the quarantine. The school thing, listen, all I'm asking for our leaders to allow the parents to make a choice. If you don't want to send your kid to school, I would not send my kid to school. That's what I've been telling everyone that's asking me, what do you think? I said, I cannot give you advice. I tell you what I would do. I wouldn't send them. But they are being threatened by the DOE. They are being threatened to be sent to child welfare services. All of that nonsense got to stop. It's a choice. If you want to send your kid to school because you believe it's safe and you want your kid to get that face-to-face, by all means, do it. But if you don't, you should not be threatened with any kind of action. I wish I had a kid. I would keep him home and wait for the first knucklehead come tell me, Mel, you're under arrest. Oh, please. Because my attorney would have a field day. So anyway, if you could just touch on that, Doc, start off with the quarantine, because I think that's crazy. And I could be wrong. I don't even know what your position is, but and then the schools.
Okay, you guys know I was a little bit late and just finished Hawaii News Now that will be on tonight with Ben Gutierrez for the schools. But I just finished another segment. I've been on now like 7 consecutive nights for CNN, and that's CNN International and CNN Worldwide. And what did we just talk about? The whole dysfunctional CDC policy of quarantine and isolation and what it means. And, clip will be on my Facebook whenever they send it to me. But it's just a disaster. So it first starts up at the CDC level. It was such a disaster that Walensky, the head, makes this announcement in the middle of a surge. All right. That is just absolutely ridiculous. And then, the states had the opportunity to do something different, but the policy itself is horrible. And what basically we talked about on my recent CNN interview, and I'm getting this across the country and the world from my colleagues, because I'm dealing with experts all over the world, is that, and if you watch my piece, I said, first of all, when they made this policy, what about starting at the major problem? And we've talked about it before, and that's the masks. They're talking about, you do 5 days, but you wear a mask. Well, wait a second. We still have a country that has no clue, and they think masks are stylish, or they could be worn below your nose, or that a gator's a mask or whatever. That's pathetic that they went and they are going to put people at risk in indoor environments, but with that foolish policy that has so many wrong issues associated with it. That is not a one size fits all. What you've done is you've just let the country, and we're seeing it right in our state now, follow suit, that basically people are going to feel that this policy change right in the middle of all the myths with Omicron means it's not that serious. You only have to wear it 5 days, or, you don't even really have to quarantine or isolation. You don't have to isolate. Nah, they don't mean me. I can go out. It's pathetic. It's pathetic. It's pathetic because it's going to put more of our population at risk. It's going to cause more spread. And the issues that they, stated today in the press conference and have been stated are, one, again, they don't talk about masks, but then they also don't talk about all the caveats. It's one of those things where if you have a policy and then there's all this fine print below, where as people that are living this, we would have put in like 20 caveats to say, if you're immunosuppressed and you're positive, you may be spewing virus for 10 days. And, and depending on your symptoms and when they started and when they ended, you probably should get some antigen tests and to check that if you're going to be around people that are at high risk. I mean, there's a million caveats that are wrong with that policy. And that policy just sends the wrong message, especially with the people who want there to be no COVID, the people who may not be vaccinated, or the people who are basically just going like this to the government and saying, I don't believe in it. And they're going to get infected and they're going to say, I'm not isolating and quarantining, and we're going to spew it everywhere. So, I mean, it's just, that part is pathetic. Then, the other thing I talked to my CNN about is FDA just came out this morning and is stating, those antigen tests, we're starting to do testing. We're finding that they're not picking up the Omicron. So we'll let you know which ones, but here's already 3 that don't pick it up, but stay tuned. So great. So now we have that issue. Because is there any guidance about how to use those tests, which are now being spewed everywhere as like the savior, and how to use them correctly and not use them? We talked about that on my CNN piece also, which is how they're so inaccurate, they should be for serial testing, right? For day 1, day 3, day 5. So, okay, let's skip over to schools. I'm livid about that. I mean, I'm just livid about, because DOE has been pathetic from day one, and they have, if you look for any cogent information from DOE that talks about it, where is it, man? Where is it? It's not out there. Now, let me add something to this story about risk and concern, and I hope they come out tomorrow with guns blazing. I'm a 35-year-old son of a mother who taught school for 35 years. And we are putting our teachers in the front line. And all of us know what our teachers are like. We have a lot of them who have decided that they love the profession and they're going to stick with it. And we have, I have so many patients that are teachers that are 60, 65, even older. And a lot of them have health risks. A lot of them are diabetic, but they have to go, they're forced to go back, and they're forced to go in a little classroom where no one has gone through and done the proper evaluations of their classrooms and talked about pure ventilation. I've talked to teachers again and again and again, and they're basically on their own. There's been no policy from DOE. They talk about it, they do this, but then they say to the principal, "You're on your own," and the principal says to the teacher, "You're on your own," because they don't have any time to do it. So between the filtration and ventilation that's needed, which clearly we know what our schools look like all over the state, they're different everywhere. It just doesn't help anybody. It's not going to protect anybody. And so then what about the, probably minimum of 10 to 15% of the kids who are students in our school who are at risk, whether they're asthmatic, or they have lung issues, or they have chronic health issues, or they're insulin dependent diabetic kids, or they're overweight. Hey, I'm not going to criticize them, but sometimes a family passes it down, and we got some big damn kids in our state. Well, they're all at risk. Those are the kids who end up in the hospital. But we're not going to talk about them. We're not going to do anything. We don't care. We're just going to push this little button and say, yeah, go back. And then the next thing is, I've been involved in the entire country with my group across the country. I've helped design the policy. On the 17th of December, CDC came out, and the same day President Biden came out and spewed bucket loads of money across the country for a program called Test to Stay. And it's pretty much an innovative program of how you are using tests within the school. And guess what? It's being used now, and it's flowing across the entire United States. Oh, but are we in the United States here? They don't even know about it. I've been querying all through everywhere, and they don't have a freaking clue about what this program is, which is how to go ahead and mandate this certain testing program, this cadence that protects the students throughout. What's our program? What's our testing program? How about like Monday, when kids have been home for 2 weeks and there's the disease ripping through our state? You going to test them all before they come in? Nah, let them all come back positive and just spew it to the teachers and all the other kids, and then we'll just kind of cover it up, and then we'll just hide it. It's wrong. It's totally wrong. Do I agree that our kids really need to be testing or going to school in person? Yeah, of course, but it's always got to be safe. It's got to be safe. And then the other thing is, if you put the right policy in play and you actually really followed best practice guideline, we would be able to go to one spot and we would be able to see, which if you're a parent out there, demand this from your school. Show me your policy, show me your guidelines, show me your testing guidelines, show me your ventilation, show me. We pay them. They work for you. But boy, in this state, no, they act like, the DOE head, sits there like he's like a freaking king of a fiefdom. Like, well, I'm kind of independent from the state, and I'm a king, and I get to say whatever I want. And no one legislature. Where are you? You talking to DOE, governor? Let me tell you some of the stuff that fired up on my phone through today. This has been one of the most incredulous days on text. So. This morning, a high-level news official said, hey, what do you think we put governor's picture on the side of a milk box and say, have you seen this person? He may be wandering around looking lost or thinking about what he should do next. And then the other thing that I got is like people saying, during this press conference, well, he's really earning his name of Rick Trump Jardy. Yep, that Trump Jardy is really pushing out there. And then another one said, well, do you see that earpiece in? It's connected right to DeSantis, who's telling him what to say. I mean, talk about a dude that's putting his colors out about where he comes from. Oh my God, and I just heard so many things because this was nothing but supporting business and supporting special interest and basically just saying the hell with the people. The restaurant industry was so happy about what I said. Anyways, I'm sorry, man. I could just kind of spew on and on.
Well, let me say this. You're absolutely right. And see what I get upset about is, when you get places like Australia. I'm gonna jump off the rails for a little bit, just to show a point. When you get places like Australia that knows that have the great population of great white sharks, right? In all the beaches you go to, right? They have all of these floaters that go out because why? They have a very, very heavy steel net under it to protect the swimmers from any great white attacks inshore. Common sense would tell you that, right? So now we got these numbers that's just exploding, and yet we have the opportunity to put that net out to protect those of us who call Hawaii their home, to try to prevent more from coming in. But no, they want. I mean, Ikomomai is nice. Come inside. But gee, we always hear stuff like, "Hey, it's okay to come, but just don't bring your opala, don't bring your rubbish." And then you get guys, and this goes for everybody. I'm not just singling out the traveler. This even goes for our local people. But yet, I gotta admit one thing: we get plenty of Akamai locals that go and they test themselves on the way back. Mel, you did it. You did it, and you made sure you and Patsy were safe. I got workers that came back from the mainland, and they did it. So what's so hard about doing simple things like this? No, the administration wants everybody to know that they should already know this and do it on their own. Well, come on. That's the reason why we get one spread, because people are not doing it on their own. Okay. And these are one of the times that you have to really put things in context and say, you know what? We gotta put up the gauntlet, and we gotta make you pass through it. Because if not, you're gonna go sideways. You're gonna go sideways on this whole thing. And that is what I am very, very much afraid of. Because we're beyond the point of saying, yeah, you can do it. You're an adult, you can do it. Well, guess what? A lot of adults getting sick because they would have rather gone to a concert. Yeah, I understand you've been cooped up. But like we said, you can go into a concert, but doesn't mean you got to get in the middle of the crowd. You could have stayed way on the high on the balcony and watch the same damn thing. But you wanted to be right in the middle of the thick of things. And what happened? Then you wonder, oh, yeah, getting sick. Then no cry. Don't cry once you get sick. That's
Yeah, Charlie, we tested tomorrow 11:30. We test again.
because you're
Uh,
responsible, Mel. You're responsible.
well, we were raised, and my dad is watching, my mom is in heaven watching, but they taught us that way to care about other people. And it's like you bring up a good example about the concert. Why would you go on a concert and not be safe about it? You want to travel safe. I tested the night before I flew out. If I had tested positive, my Okole would be still in Oregon right now. But no one's doing that. And then they come here. I posted today. I put out the question for someone of authority to tell me how many of our visitors went back home, got sick, and tested positive, and that they were positive when they were in Hawaii, or sick, passing the virus. There is no way of tracking that. We don't know. But yet, when you listen to our experts, our leaders, our policymakers, they'll say only 1% of the cases are visitor related. Huh? How you guys think we that dumb? You like we that stupid? I just want to get to this real quick because there are issues with uh, parents, and I saw this in the comment more than once, that have no way of taking care of their kids because of childcare. They don't have teleworking opportunities. They got to go to work. And also, teachers and students, are they being properly outfitted with PPE? Are they being given the necessary equipment to be safe? Are they being tested? And then you hear about the money. We no more money. We no more money. But yet we willing to put $350 million into a stadium complex on Oahu. I listen, money should not be the reason. And listen, I know I was in politics a long time. There's always money. It's never a money issue, it's a priority issue. They have chosen not to keep our people safe. They have chosen not to make that a priority. Do not tell me we cannot go out there and get federal funds. We cannot go out there and float a bond. We cannot go out there and get money to take care of our people. If you have a mom or a dad or a family that cannot afford childcare, we should be helping. We should be providing our students and teachers with proper equipment so they're safe, and we should be providing testing. None of that is in the discussion, Doc. It's just Blangiardi pointed his finger. If I was out, break his finger. I'm telling you right now, if he pointed his finger in my face, I'd break his finger.
Hey, let me jump in.
That is so inappropriate, especially here in Hawaii. Yep. And he went up there and pounded his chest. So unprofessional. I've absolutely lost all respect for him. But not one word about helping moms, dads. Not one thing about helping the people. Only thing was, it's on you. It's if we blow up, it's because of you. Don't expect us to help you. Did I hear wrong, Doc?
No, you heard right. Oh yeah, and then and about 50 different times he pointed his finger and took his little tantrum and said it's on you. And then about halfway in he goes, well, I know leadership, and leadership is like, the buck stops with me. I'm responsible. But then 50 other times he says, it's all you, this is all, and then you have to do a soft shutdown. It was just so wrong. And then, one of the things I wanted to comment back to what you were saying, you know what? We need to have our legislature jump up, because I know for a fact, and we've seen data, that the amount of federal money that is sitting in the state coffers that they have done nothing with, and is in state coffers and is there for schools, it's massive. It's massive. And that's what you should do to go to these moms and dads and families that are scrambling to help them. But no, it's in a freaking piggy bank under the governor's desk right now, and under, in Blangiardi's closet right now. Where's the accountability to that? Who's saying that is being allocated the right way right now? So, that's a thing. There has been federal money pouring out of the sky. It's the true manna from heaven. Yeah. But has our state done anything to really give it to the people? Actually, to his credit, Kurt Caldwell was really pretty good at giving it away to people and trying to get it out to all people and things like that. But Zippo, this is like, well, but I'll take care of all the industries and things like that. But the hell with the people who are disabled coming out of work, or who are in the hospital, or sitting at home with oxygen tanks sitting around them. What about those? What about those, Mayor? You're causing all of them. Guess what? You're causing all of them. This 1,000, 1,300, 2,000 positives. Guess what? That's in one day. 8 to 10% of those people will never work another day in their life. They will be disabled the rest of their life. They will never be able to care for their family. And then, another percentage that are on oxygen are going to die next year, half of them. And then they're going to keep on passing away. What about them? So don't just look at the damn hospitals and how many people are in hospital beds. That is just such a small amount of the suffering that happens in the world and in our country and in our state. So if we have 130 in the hospital, we have another 13,000 that are suffering, and their families are dealing with them. I mean, if I could just tell you the stories of just who I was trying to help today, where we're giving Regeneron and we're giving treatments as people's elderly parents are getting it, and they have nowhere to go, and they're suffering, and people are, home with big extended families, since 1 out of 5 of our households live in multi-generational households. But are we talking to them? No. Are we doing anything to help them? No, of course not. Of course not. because basically all his policy is racist, pure racist that ignores people of Native Hawaiian ancestry, Pacific Islanders, or the Filipinos. You don't mean anything because you're not going to give a campaign donation. You're poor. You're poor. So you live out in the edges of Waianae. Whatever, you chose to be there. That you're on personal responsibility, even though you have a 35 or 40% positivity rate, and the disease gets into your family and rips through your household. How about talking to those families, right? How about talking about the suffering that they're feeling? And of course, we don't have any quarantine hotels because you decided you're not going to do it anymore. And the state just blew it by just dropping it. I mean, why doesn't governor just retire? Why is he even bothering sitting in that office if he's not going to stand up and fight for the people? So.
Hey, Doc, real quick, you mentioned Regeneron. I know Scotty's been asking this question. He's been asking the question on the press conferences. No one has asked, but the Regeneron, I think from what he said, President Biden is saying not to use Regeneron for Omicron. You have any insights on that? I mean, I've heard it may not work as well, but it still works. What do you know about that?
Oh, I can tell you all about it. You're going to get me just all fired up on an entire another topic. All right. So first of all, what they're not going to be doing is doing any broad scale distribution of Regeneron, because Regeneron versus and the other three main ones besides Regeneron are not showing as high of efficacy. It's not as efficacious against Omicron. So they're trying to give the other one now, which is Soltrovimab, out. Well, geez, thanks a lot, because I'm on the group that because I get it and I use it, and I'm using it in a nursing home, so I get the mailing for people to put orders in. Well, guess what? It's rationed across the United States, and the state of Hawaii, we're getting, I don't know, like 120 doses over the next week. Give me a freaking break. Okay. So then the next issue associated with it is go back to what we started my discussion with. Right now, we have no freaking clue of how much Omicron we have versus Delta. Right now, statistically, we definitely probably still have more Delta here than Omicron if you use the best data that DOH gives us, and if you look at the statistics and the way it's spreading across the country. And guess what? I have no other alternative, as I have these people who are facing extraordinarily high risk and are positive. And so we've been giving our supplies of Regeneron constantly. And guess what? It's working. These people are getting better. The people are getting better. So from the standpoint of what is being said, Scotty's saying is true. And yet, on the other hand, we have this massive issue, which is we don't have any of our labs that are doing the first preliminary analysis to give us providers an indication whether it's Omicron or it's Delta. There's something called the S drop, which occurs. It's a gene that drops in Omicron, and it's one of the three main things that most of the big lab-based PCR machines will do. Well, it just so happens that most all of our PCRs run in the state here are not giving us that data. So we have to wait to get it sent to the DOH, which then takes 6, 8, 10 days to sequence, and then they only sequence a sample. And other states I'm working in, I'm having them try to get positives automatically sent within 24 hours to be run on machines that will tell us whether there's S drop. And then we should know. S drop, let's just assume it's Omicron. If it's not S drop, let's assume it's Delta, and let's treat them appropriately. Now, the next thing that is just total garbage is we have the miracle drug coming out, Paxlovid. right? Paxlovid is coming out. It is going to be great because it's 88 and 89% effective if started within 3 days of your symptoms beginning, right? No later than 5 days. It's a twice a day medication course for 5 days, similar to what you would do with Tamiflu. We get 240 doses for the entire state between the 5th of January and the 12th of January. And what do? They're shipping them to some of the hospitals, and then they're shipping some to a couple of the community health centers. And I just blew up at this, and I sent information all over to people who are out there. And oh, by the way, and they're being distributed by the Healthcare Association. That's the lobbying group for the hospitals. They're not a medical association. They've been given the keys to all these cars, and I said, like, okay, so now the hospitals get it, and what do? Do they give it to their friends and family? How does a private patient of a private doctor or an urgent care or a practice over in Kau know that they can get this? What are the policies? Zip, nothing. They've just basically have distributed the life-saving medicine that is in limited short supply, and nothing. So another disaster right now that's occurring, and we have so many disasters that are occurring. No one can even talk about that one, and no one can give me answers because I'm just firing off questions right and left to say, hello, I'm dealing with states across the country, and this is what a civilized state does. They basically give it to a few pharmacies in different regions. Then they have a preset form that you have to fill out as a doctor and send it electronically to the pharmacy that shows exactly why this ultra high risk patient needs this medicine. And you have to put your name on that, and you have to verify with detail that this patient deserves it, and it's not a friend or family. That's how you do it. You don't put it in the hospitals. And then what you've done is you've automatically cut off probably 60% of the entire state now doesn't have access to any of that. It just,
Well, after tonight, you're gonna find that you're gonna have a tougher time getting answers from anybody.
yeah, yeah. I
Hey,
always,
you know, one of our good brothers out there, and you know who I'm talking about, Mel. Anyway, he sent a suggestion just now. He said, take all the video clips of our show the past 2 years, right, and put them together and show them this weekend, and just we'll call it a special of the predictions made by Mel and Charlie and their guests of what's to come. And we said this some time ago. What's happening now? What's about to come? And it was like it was a prediction done way back when, and then we can compare it to what the same officials now are telling us, the same hogwash that they said back then, and how everything evolved into a really bad situation. We should do that for this weekend.
Charlie, it does feel like deja vu, but
Deja vu.
2 years, 2 years. You would think by now that some attitudes would have changed, right? We know so much more today than we did when we started, but the level of stupidity has not changed. It's actually probably grown from decision makers. They haven't learned from what works and what doesn't, and they're testing the waters. They're playing with fire, and they're risking our safety, and that's what really pisses me off so much. Is because, come on, man, you talk
Hey,
about ventilation and filtration of schools, doc.
yep,
We've had 2 years. I go back to that stadium complex. In original plans, they wanted to get it built in 2.5 years. See, if they
yep.
want to do something, they'll get it done. You cannot tell me that we couldn't get proper filtration and ventilation in our schools in 2 years, because we should prepare for the next pandemic and not just wait and ride this out and see how many kids get sick. So I'm really, really irritated. But
Well,
Doc, I wanna your tap
Mel, real
your
fast, Mel,
yeah,
uh,
yeah.
real fast. Didn't we get a message today about how someone in the medical field at one of our facilities helped push a person who passed away, right, from from uh, from COVID, and that person's a trooper. I can't mention the name nor the facility, but the person that she was pushing, I guess, to the area where you put someone who just passed away, unknowing was her relative who died from COVID. You see how hard that is.
Yeah,
That's why when you start targeting medical professionals or people in the industry saying that nothing really bad happening, well, you talk to these people who are now helping, not knowing until the final end where they put the person to rest, right? That it's their family member. You know how hard it is?
yeah. You know that's why it started off with Blangiardi's conference today. It started off where he really praised the healthcare workers and try to convince everybody that he cared. And then he just basically took a dump on them and then closed with the same bullshit comment. We know our hospitals are overwhelmed already. He keeps using the COVID beds, but the hospitals service much more than COVID patients. We are reading the comments right now. We're seeing people that actually work in hospitals telling us that they're not given N95. They're using surgical masks, doubling up, tripling up. We're hearing from people locally here on Kauai that our nurses are working double, triple shifts. We hear this, and he can stand up there and say we're in a good place. He's lying. He cannot tell me he doesn't know. And when in the governor's press conference with Libby Char, when the question was posed of her about the hospitalization, she said she doesn't track hospitalizations. That's left to the Hospital Association of Hawaii, the foreigner, whatever his name is. What his name? I keep forgetting.
Hilton Rayfeld.
So why isn't our Department of Health director tracking hospitalizations in a pandemic? I would fire her. I know you like her, Doc. I know you have a lot of respect for her, but I would fire her. If I asked her a question and said, what are the hospitals? And she said, we don't track, I would fire her on the spot if I was the governor. I would. But I wanted to go over this because, and I know, Doc, I hope you don't mind we keep you on a little while longer. Is that okay?
Yeah, no, it's okay. I got power now. My computer's not going to die. So
because I know there's a lot of people that probably don't know what this 5-day quarantine thing is. And I just want to, because it's so brief, it's not going to take any time. If you're positive, and I'm going to go through the 3 different sections, and then I want you to share your comments. If you test positive, you will isolate for at least 5 days or until your symptoms are gone. And then you continue to wear a mask for 5 days after isolation. I thought we had to wear a mask always. 5 days you got to wear a mask. That's it. If you test positive, you quarantine or isolate for 5 days, and then you no need tests. You just go back to work, go back to do whatever you do. Okay, so that's if you test positive. If you're exposed to, so now you get the call from the Department of Health. Hey, you're a close contact. You were exposed. If you're boosted or fully vaccinated within the past 6 months or 2 months with Johnson & Johnson, no need quarantine. No need quarantine. Now, this is where I get very angry. You got to wear a mask for 10 days. So I guess after 10 days, hamo. And then you got to get tested on day 5. So you get 5 days of possibly infecting others. Remember now, this is Omicron. Very, very contagious. So that's it. If you're vaccinated and boosted, no need quarantine now. This is what bothers me. And everybody knows my position on vaccines. I support vaccines, but I also support choice. Neither boosted nor fully. So if you're not boosted or vaccinated, you got to quarantine for 5 days, and then you got to wear a mask for 5 days. Remember, if you was vaccinated, you got to wear them for 10. But if you're not vaccinated or boosted, you got to wear a mask for 5 days after quarantine, and then you got to get tested on day 5. Doc, I'm going to ask you this, and I want your very honest opinion. We know for a fact this virus spreads from vaccinated and unvaccinated people. This state is constantly trying to put a divide through vaccinated and unvaccinated people, and that pisses me off, honestly, because there are some people that cannot get the vaccine. But what is the sense of allowing a boosted or fully vaccinated person to go free without any quarantine after being exposed, and the unvaccinated guy got to stay home for 5 days? What is the rationale when we know for a fact that a very high percentage of people that are vaccinated are spreading the virus? What is the rationale? And I understand your position with CDC. They're screwed up. But why would our governor, with the sidekick called Josh Green, who's supposedly a medical doctor, and with Libby Char, who's a doctor, why would the governor accept these dumb standards for our people?
I can't ever try to make any kind of insinuation that anybody could ever understand what's in David Ige's mind. No clue whatsoever. What I can tell you is I'm going to make a global point. I am working all over the country and actually all over the world, and you will see almost two worlds in the U.S. with our states. Our state, which was just pathetically famous back during the time of the Park and Anderson, just pathos, were cut and paste CDCs. Whatever CDC did, they cut and pasted and said, that's it. Didn't explain it, didn't do anything, didn't challenge it. Well, that was a problem because CDC, as this is going to be looked at, just as this is pathetic, just like their May 13th guideline to stop wearing masks because COVID's going away, killed 200,000 people. This is going to create more havoc in the middle and so across the country. Then I'm working with very, very progressive departments of health who have leaders and leadership throughout that are so incredible that they scrutinize and they take it and they discuss it, and they're working freaking 18 hours a day, and they come up with a customized policy, and they don't care what happens, because one of the things that does happen is you have this subverted underground community that will try to sue the shit out of everybody if it's something that they don't like. So that's the other thing that's happening, is people use our legal system to try to overturn, some of these guidelines. So I can tell you a lot of this is not just common to Hawaii, where they'll take a guideline from CDC and they cut and paste it. Now, here's the thing we have to everybody listening needs to understand. CDC is an advisory body, okay? Anything they say is advising the state to think about it and consider it. The only laws that are coming out of the federal government right now through the CDC are you must wear your mask in an airport, in an airplane on federal ground. That's a law. Otherwise, every state, every county, every department can do whatever the hell they want about quarantine, isolation, mask wearing, testing. It's up to them. So, sorry.
Yeah, CDC is the Centers for Destruction and Confusion. That's the new term.
Yeah, I mean, and guys, I have to say with you, I really would. I'd love to have some of the past episodes, because I just finished recording, and tonight will be my 91st appearance on CNN, and I have my own producers. Every day I communicate with them. I send them information because they want me to know what's newsworthy, and they want me to know what the facts. I got called by Sanjay Gupta's team. They wanted to share my research team, because they said that of all their guests that they have, I've been the most accurate in predicting the future, and they want to know where I get my data from. And they keep putting me on again and again and again and again. And I'm speaking 3/4 of the time, I'm speaking to the entire world. And like today's piece, they had me, and they play a clip from Fauci, and they say, well, do you agree with Dr. Fauci? And in this clip they played today, it was like, no, because he was talking about the same everything we're just talking about right now with the mandates, and he was talking about the testing and why no testing is needed. Well, because it's kind of what we know about the disease, and it goes, and the test won't get it anyways. And I was like, no, that's not right. So
You know what? You know what's funny, Doc? They only realized this 5-day thing. They only realized it after they got the letter from Delta Airlines president CEO saying, please drop the quarantine down to 5 days because we cannot keep our workers. Only
that's right.
then they all of a sudden, oh, yeah, 5 days, 5 days. Oh man.
You know,
It's
Mel, I think I might have said that, because I'm live and I'm fired up on these things. I think I might have even said that when I was talking on today, when I was saying, and they come back and they go, well, why would they do it? And I was like, well, this seems like this is almost a policy driven by economic interests and not medical interests, because we know across the country that Omicron is so infective with Delta that businesses are not putting employees to work because it's spreading. And so this is wrong. You can't put economic interest ahead of the safety and welfare of our people. So
the one thing you got to give Blangiardi credit for. He was not ashamed to show his bias to business. He was not ashamed to acknowledge that he has a bias and that he is making decisions for economic reasons and not health reasons. So you got to give him that. It's a shitty platform, but it is what it is.
When's our legislature come in session? I don't know if it's going to do anything because they've had a damn long time to do something, but it's like, give me some break, man. We need to get some kind of balance of power. Remember, our country is built on 3 systems of balance of power, executive, legislative, and judicial. And, judicial's not really involved in nothing from our legislative branch.
Well, I will say this, though. My wife works for the judiciary, and I got to give them credit. They are required to test within 24 hours of their arrival back home, and they're required to test on day 3.
Oh, I have no problems with their testing policy. What I'm talking about is them, and I've been reading some of the comments where people were saying we should have a class action, we should be suing these people, we should be standing up for breach of their ability as executives to protect the people. What I'm saying is the judicial part of our government is not standing up for the people being put in danger by reckless decisions, right? Who knows? Maybe it is going to happen. Maybe, I'm just surprised that Michael Green and a couple of these other attorneys that, take big old cases don't grab, 300 people who died of COVID and file a class action against somebody, or especially if your family died where you were vaccinated. And oh my God, it's just wrong. There is needless loss of life by policy decisions that are being made. Preventable loss of life. So
I think Charlie wants to strike someone, but I know Charlie too well. I'm kind of afraid that somebody gonna get hurt. But anyway, hey Doc, one more thing, and then I will shut up. And cruise ships coming back January, bro. Cruise ships coming back.
Yeah, and right now, as of today, 85 cruise ships have positives on them. 2 cruise ships finally found a port to get off of. 85 different cruise ships out there have positives. And we're going to be like, oh yeah, let these people come on and off, and they'll come into our stores and shops and let them kind of infect all our restaurant workers and all the people in the shops and stores and things like that. But just pathetic, man. It's going to get better if the people just realize I get asked this all the time. Oh, is it going to just spike and be gone in January 10th? No. All the projections are we might hit. And first of all, I'll qualify this. I don't know. No one knows for sure. We're going to be able to have a warning when we start seeing what happens in Europe. Once things change in Europe, we might see a happen a little bit parallel to that. But right now, the best projections are saying that we are going to have peaks in mid to late February, probably by April 15 or so. Sometime in April, we're going to be way on the downside and having a lot of improvement, as long as there's not another, variant, and as long as Delta hasn't re-emerged its head, or another, Delta Plus has come out or something like that. So we will get through it. So we're not talking about doing anything. We need, we have the opportunity, if we would just kind of tighten our belt through the month of January, that we could still have a relatively safer post-winter, tourism season, if that's all they make decisions over. But we could have our hospital workers have a little bit of a breath, and we could save some lives. Now, no one's looking at that. Now we're saying we're going to open up cruise ships, and we're just going to just keep encouraging workers to, or keep encouraging tourists who we are not updating safe travels, as we know that there's so many people, if they only have 2 vaccines. Oh, we will take some time. Let's do it like March. Yeah, we'll do it in March. Great, great. So, yeah, unreal.
Yep.
Okay, well,
Tomorrow night, guys, we have Tim Brown, Lee Altenberg, Capono Chong Hansen, and Daryl Carroll be on to share their insights. I cannot wait to hear Tim Brown tomorrow. I think he's not a happy camper right now, and they are the ones that are doing the modeling. And anyway, we'll get some good insights tomorrow. But Charlie, you've been too quiet. You're making me really, 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 really nervous now, Charles.
No, it's just I'm caught up in my thoughts. I'm still, I am just one of those that now I just love what the doc is saying tonight, because yes, he has been spot on. I think if we just isolate him on all the time he's been on since day one, he's caught it. He's called it as it was. He's given us all the breakdown of what we should be taking, what we should be doing. And for those of us that followed his lead, we fared very well. And for all the experts other than himself, that I guess was advising the administrations of this state, I guess they haven't been doing so well. So that kind of tells you where we're at. So if there's anything to say to the people out there in Hawaii, again, this is all about information time. Because if we had the power to, bully things around, but we're not like that. And what we're trying to say is, it should be the administrations should be caring for its people, because they got voted into office. All I can say is, remember 2022, it's right around the corner. And if we don't want to see any more of this nonsense, we got to make changes. And all we're asking for is a fair shake at everything that happens, because yes, we have to take care of ourselves. But you don't go and push the envelope and say, well, because I know a lot of people say, man, I got boosted, I got this, I can do anything. Okay, well, maybe you skydive one time with an expert that you're tied up to. Does it mean the next time you can go by yourself and jump on a plane? No, it doesn't work that way. And so is with this. You still got to be safe, and you still got to take the necessary precautions. And I think that's is what's frustrating everybody right now, because the higher ups are just not using common sense, and it's getting everyone irritated. So what I say is, we can keep our sanity by keeping our common sense alive within ourselves, and that's what I'm going to do. But I'm going to say right now for the people out there in the village, Charlie Iona is not going to give up on Mel, and I hope Mel doesn't give up on me because we're going to keep on bringing it to you no matter what way we have to do it. We're just going to keep on doing it.
Thank you, Charlie. Doc, before I ask you to put in some closing comments, right after this show, we'll be on the clubhouse. If you look in the comments, look for Dana Moore's. She has the link. Please, please, please do me a favor. Sign on with Clubhouse. We don't get paid for it, but it's a great discussion. It's going to be good tonight. So download the app, sign on to that link. You'll get the invite. You'll get straight into the clubhouse, into our room, and hopefully we see you guys there tonight. Miscovich, if you can make it, man, we'd love to have you. It gets a little colorful at times. Perfect. I like it. Anyway, Misco, what's your closing thoughts, sir?
My closing thoughts are, Charlie, it's great that Mel and I have you, man, because just hearing your voice, it just does calm me a little bit because, I'm freaking livid and I have been livid.
I can tell.
But I look at Charlie and I look at him smiling and I look at him staring. A few times I thought your camera was frozen. And if I didn't see your fan going in the background, I would have thought that you were like, a big frozen bear there looking at me. But it's a calming force. So thank you, Charlie.
You're welcome, my friend.
Thank you.
Welcome.
Okay. So with that said, one of the issues that we have to do, since I have this level of calmness, the state has to understand, the leaders have to understand, this is a pandemic. This is a healthcare event. This is an event where good leaders across the state and world surround themselves with great medical advice. We don't expect all the leaders to know everything, and they take it and they assimilate it. And then a good leader would have a medical advisory group every day producing a summary statement of all the top data and all the top information. And it would be a white paper bullet point that would be backed by facts and backed by data. And those people would be held accountable if they basically said something and then 2 weeks later it was blown out of the water and they were like, oh, sorry, mate. No, that's what leadership should be doing right now across our country and across the world. And now what we've done is at least we do have some good, competent people. We have epidemiologists and infectious disease and people in the Department of Health who are working their butts off. But we have plenty of intelligent people that really understand this, and you have tons of them on your show. And there should be briefings that are put up to the governor every single day, and he should then be utilizing that where he can just put it out, show it, make it available for the public. If someone wants to know where the decisions are made, it comes from here and it comes from the facts. Do we have one idea ever what medical facts the governor has ever used to make a decision? The answer is no. And who's advising him? Well, we know for a fact he doesn't listen to Libby. I mean, because she's coming right out on one side and saying exactly opposite, where she's saying we should shut down. I think we should put warnings, that we should put restrictions into place. She's saying all those things. So now what we've done is we've turned 1 million people and their lives in the island of Oahu over to a person that just is zero healthcare experience, does not listen one iota to a healthcare person. And he even has the audacity to call the two heads of two health systems medical personnel, medical staff. Again, Ray Vera is brilliant. He's running the best health system here. What he's done is incredible. Tons of respect. And I know Jill. And, Jill just came to Hawaii a couple years ago. And, she's wrestling all the bears that live in the hallways of Queens. But these are not people that are medical experts in the field of infectious disease, epidemiology, public health, population health, testing accuracy, vaccination accuracy. That's who should be advising our leaders. But what we do, we've turned it over to a bunch of freaking, mayors that have no clue. And who are they turning to? Who are they turning to ask? Who took, your Department of Health rep, Dr. Berryman's probably one of the best of all the other islands, and so she's done a really solid job. So I would say she's probably head and shoulders above, but otherwise there's nothing. I know for a fact Mitch Roth on the Big Island, zip, no one. Has no medical advisory, unless you're, close to him politically. He's nothing. He's not, he doesn't listen to anybody. I know Mike Victorino. I've been talking to him recently. He's trying. He's probably going to do some good things, but he would take help in a second. And then clearly, you saw it today where Blangiardi had the nerve to just rip the Department of Health. He started out angry, kind of pointing at it and yelling at our Department of Health in the middle of a pandemic. Pathetic. So I'm sorry I could blabble on, but people, you do have to do what you can do right now, and you just can't trust anybody in your government to support you right now. You just have to take care of your family, get a great fitting N95, get boosted. If your kids are at risk, don't send them back to school. If they have any health risks, don't send them back to school. If you're a teacher and you have any health risks, screw it. Do not go back to that classroom. Stay home. That's the best thing.
Hey, Doc, a quick question for you, Doc.
Yeah.
I had my booster, I guess, it's been maybe 2 months ago. Yes, it's about 2 months ago. When can I get ready to get another shot?
Okay. So by U.S. pathetic CDC Pathos, one of the only countries that are still holding to 6 months, they're going to say 6 months, right? Okay.
Yeah.
So here's the reality. If you have a good progressive doctor and you realize that those vaccination guidelines, what did I just tell you about 20 minutes ago? CDC is an advisory body. So if, as a doctor, I look at my patient, which a lot of the endocrinologists and a lot of the infectious disease and oncologists are doing, and they're looking at their patients and they're realizing that they have or kidney transplant, et cetera, they're massive immune deficiencies. Some of them are getting it monthly, right? I can tell you in a second, if you have risk factors, a good doctor will write you a prescription or just tell you 3 months. So that's the end of the answer I would tell you, Charlie. 3 months would be no questions asked. And if there's any doctors out there, remember, CDC is advisory. If you determine in your medical opinion that a patient has a risk, right now, progressive countries are going 3 months. And that's my answer.
Thank you. Okay.
Well, Doc, thanks. Thanks again for your time. I know we went over. We want to hang on to you all night long. Our viewers, I saw a couple of viewers say, "Well, it's almost 8 o'clock. I don't want this to end." We appreciate you. We appreciate you so much. For those of you out there watching, wondering what can we do, the first thing is tonight when you go sleep, say a prayer. Say a prayer for our decision makers. Say a prayer for everyone that is ill, for all our families that have lost loved ones. Just say a prayer. Tomorrow morning when you wake up, just pretend that today didn't happen. And in fact, the governor came out and said, we implemented restrictions. We implemented testing. We implemented all of these things. And just pretend that it's in place. We really don't need an order for us to do what we need to do to stay safe. So let's just wake up in the morning and pretend that he did the right thing, even though we know he didn't. And for those of you on Oahu, we ask for extra prayers for you all, because what your mayor did today was open the floodgates. So we will pray for all of you as well.
Hey
But yeah,
Mel, you
yeah.
have those pictures that I sent you? Were you able?
Oh, on my other computer,
Oh,
the
okay.
one that didn't work.
Okay,
Yeah.
no
I'll
problem.
try to get that. I'll try to get that for tomorrow night.
Hey, and
The other
and
thing you
please,
can do. I'm sorry.
please pray for all the healthcare workers that are out there,
Yes.
just trying to do the best they can, and get and if you know any, thank them, bake them something nice, do anything you can, man, because those are the heroes that are just being ignored by these administrations.
Yeah. And
Yep.
I'm gonna ask Dr. Akiona for next week to come up with an all-woman panel of healthcare workers. And I'm serious. I'm dead
Yeah,
serious.
man.
We want to hear from them. We want to, those are the people, anyway, I'm not going to get into Blangiardi's thing, but they need to go and see firsthand what's going on, rather than
Yeah.
assume that everything's all okay. We're in a good place. I'm so over it.
I think, Mel, that's a great idea. Let's try to get, maybe we can ask Dr. Dworkin or somebody else, and I can reach out. Let's try to get a really good female Queens
Yep.
ICU COVID nurse.
Yep.
Let's get someone living this and their
Yeah.
colleagues to describe the horror that is going on right now.
Yep.
You know,
Yeah. And,
that's a
and
great.
Dr. Akiona actually suggested an all-female panel. So I'm not sexist.
No,
But let's
Go
do
for
it.
it.
We'll schedule it. We'll do it for next week. It'll be a new year next week.
I'll tune in. I'd love that. I'd love that. I'd love
But
that.
the other thing that you guys need to do, because we can gripe all we want on Facebook, and we can do all of these things, and maybe it's therapy for us. But I sent off. You saw my post today, asking the legislature, the mayors, and the councils across the state to collectively urge the state to make some changes. That again, I sent that to the newspaper, the Garden Island, as well as the Honolulu Star Advertiser. We all gotta flood emails, phones with your representatives. I've asked you all to do this before. We gotta do it. We gotta let them know how you feel, and you gotta let them know that if they're gonna sit on the sidelines, and I'm talking to you folks, that you'll be talking to your representatives in the districts that you live. You got to let them know that if they're going to sit on the sidelines, then you're not going to support them.
Mm-hmm.
If they're going to just take the politically safe road and not stand up like they did for Red Hill and let this governor and lieutenant governor run us over, then you're not going to vote for them. And you got to stand true to that. Seriously, you got to let them know, because they're out there doing their own thing. They're protecting their families. They're trying to be safe. But you got to let them know that if they're going to sit on the sideline and take the safe road, we don't need that kind of people representing us. We need people to stand up one way or the other. I have much more respect for someone that will stand up and tell me, Mel, sorry, man, I disagree with you. I agree with the governor. I can respect that. Even though we disagree, I can respect that. But what I don't respect is someone that came to you for their vote before the election and said that they will do what it takes to make your life better, and they have not said a word. I have absolutely no respect for them, because this is the most critical issue our generation has ever seen.
Yes. Yes.
Think about it. Think of all the people that got sick and all the people that died, all the controversy, all of the we will not see this again, hopefully, in our lifetime. So we got to let them know that if you guys going to take the safe road, you're not going to stand up one way or the other, we ain't voting for you. You don't let them know they think it's safe, expect no changes, all right? If you got to use my letter, rephrase it a little bit, do what you got to do, but let them know how you feel. That's what we all collectively can do. That's what the village needs to do. This village needs to grow. This village needs to become more active and engaged, not on Facebook, but in real world. Send them the letters. And I'm telling you, Tell them, if you guys sit on the sidelines, we ain't voting for you, even if it's your friends. And if they cannot handle that, oh well. Thank you all for joining us tonight. Thank you, thank you, thank you. Tomorrow night, again, Dr. Tim Brown, Dr. Lee Altenberg, Dr. Kapono Chong Hansen, and Dr. Darrell O'Carroll. It's going to be another colorful night. We hope you guys will join us. Stay safe, you guys. God bless. Dr. Miscovich, love you, my man. You stay safe. Hug the wife for us and your doggies. We appreciate your time. Don't forget Clubhouse, guys. Go track down that link. Get on a Clubhouse. I'll be on there in about 5 minutes, okay?
See you guys.